I'm so thrilled to be here at Dana-Farber and to be talking to you. And interestingly, when I really look at your focus of work, and your focus of work is young women, which, seems everywhere you look these days, it seems like there are more younger women being diagnosed with breast cancer, but also with adult survivorship. And that's, I guess, because a lot of us, like me, we're living what kind of through and beyond. And so now there has to be a focus of study as to how do we live our lives. So let's just start, though, with much more basic. It's still a grim statistic. 40,000 women or more die in this country every year from breast cancer. But there have been so many strides in the past decade, have there not?
Yes, there have been amazing strides, but we've still got a lot of work to go. The rates of breast cancer are pretty stable right now. The rates in young women are actually stable too. It's just that there are more women in the young age group, 45 and under, that are in our population. So we're seeing them more. We're seeing more young women come in with diagnoses because there are more women at risk. And there have been great strides for both young and old in terms of preventing the cancer from coming back if women develop breast cancer. And there's probably some prevention movement that's happened in terms of the numbers, but it's harder to measure that on a population basis. Meaning few people are probably preventing breast cancer better. We're learning more, but not as well as we would like. There's more to be done.
Preventing because of screening?
No, so screening detects early disease, and screening has dramatically improved how we detect early disease and improve outcomes in terms of survival. So women whose tumors are detected by screening are much more likely to not die of breast cancer than a woman who's detected by a palpable lump. That doesn't mean across the board, it's just statistically. And so for women who are detected by screening, we know, particularly for the age group between 50 and 70, that screening saves lives. For the younger group, it's much more controversial, and it does appear to save lives, but there are a lot more false positives, tests that show something that aren't anything, as well as false negatives, as in the mammogram looked fine, but the woman still had cancer.
Which was, of course, my case.
And that's what happens to a lot of people. So they're not a perfect test, the screening tests.
So, gee, where do I start? Okay, let's talk about false negatives. I was speaking with Dr. Susan Love recently, another breast cancer expert, and she said, well, part of the problem is that in the United States, gynecologists get basically from the belly button down, and breast cancer surgeons get from the belly button up. And I said, well, but you don't go to a breast cancer surgeon until after you've been diagnosed with breast cancer. Therein lies a problem. I think a lot of women, most of the women I talk to online, they've never even heard the word breast density. They are totally unaware and stunned, in fact, to think that they can go in and get a mammogram and come out with a clean bill of health and actually have cancer. Where do we begin to attack this?
Well, I think strides are being made in that the public health awareness of women of any age can and do get breast cancer, both younger and, of course, older women. And our gynecology colleagues, our primary care doctors, it is incumbent on them to not only address the women's organs, but also breasts. Men can get breast cancer too. Of course, that's much more rare. And do breast exams. Women should undergo a breast exam yearly. So depending on who you're seeing, you should have a breast exam, a clinical breast exam, every year along with your regular health maintenance, unless you're a doctor and you make a different decision, because it's very variable in terms of what's right for any given woman, but that's the standard.
And I've heard, though, that there are more breast cancers found through breast exam, either self or clinical, than actually through mammograms. So isn't it also important then for young women coming into their 20s to start understanding what their normal is and to be doing self breast exams?
You put the know their normal so perfectly. The problem with self breast exams is that we studied it, very large study in an unscreened population where you'd expect that a self breast exam would show a difference, especially if you're not getting extra testing. And it didn't improve the likelihood of women getting a diagnosis of cancer or living longer. And what we think happened there is that doing a self breast exam is a routinized monthly different way of doing, some women do a daisy pattern, that's fine. And if that's the only way you're going to pay attention to your breasts, then go ahead and do it. But most women, even women who aren't doing that, and in this study we think this is the case, feel their breasts on a regular basis because they're taking a shower, because they're being intimate with someone. And so what I recommend is that women know their own breasts, the contour, they know the changes. And that's the important thing, to know what their normal is, as you put it, and then any changes. And what changes should be brought to a doctor or other healthcare provider's attention include a lump or a bump that's new and doesn't go away with a menstrual period, is particularly large, a skin change, like a dimpling that doesn't go away quickly, or a new rash. Nipple discharge when it's bloody can be a problem, as well as a lump under the
arm.
Right, because that can be a sign of a lymph node being involved, which could be a sign of a cancer.
Because with these young women that we see being diagnosed, they're not getting mammograms because they're too young to be screened with mammograms. I mean, unless there's some huge family history or they know they have the BRCA gene or something. So most of these young women do find their own, and usually way too late because they're under that assumption that it can't be. And I think from your own studies, you found that that even after they go to the doctor, there's still a delay because quite often the doctors also assume that it can't be.
Right, and the good news again is I think that is changing. I think the word is getting out there, and there's a huge initiative from the CDC of the United States that's pushing out that young women can and do get breast cancer, and how do we increase the awareness of both providers and patients that, work it up if it's a lump that doesn't go away, and that yes, they can get breast cancer.
What do you say to those women out there? Because I hear from them and they say, I feel something in my breast, and I know it wasn't there, a month ago, 6 months ago. And I went to my doctor and I'm not getting them to do anything. Go to the second opinion?
Well, I'd say stay on it. So, the crime that gets committed in terms of, attention is not, most lumps in a young woman won't be cancer. And that's, most lumps do not end up being anything that's of concern. They go away, or it's a fibroadenoma. The problem is when a doctor sees a patient and says it's probably nothing, what the doctor should then say, and most probably do, is, but let's check you again in a couple months. Or let's get an image if it's suspicious enough. And that does seem, the patients I see, of course, have cancer as a cancer doctor. And so that's usually what happens. The patient will be told, it's probably nothing, but let's get an ultrasound. And so the doctor did the right thing, but they were trying to reassure the patient. And of course, they're like, they told me it was going to be nothing. But the bigger issue is the person who says it's probably nothing, and they don't set up a close follow-up, and they do no imaging, and the patient is reassured and goes away. And I have a number of patients in my practice where that was the case, and then 9 months later, they had a big lump and something under their arm, or even worse, back pain, and the cancer has spread. And that's the tragedy. Those are, in my experience, relatively rare, but those are the tragedies.
Because that's one of the big issues with women, young women, and breast cancer, is that it gets found at too late a stage, correct?
Yeah, not too late for treatment, but too often it's more advanced than it could have been. That's true for older women too that aren't being evaluated. So plenty of older women ignore their lumps and bumps and aren't seeing doctors. So we do see a fair bit of what we call neglected breast cancer in older women, where something's been going on, but either because of denial or because of busyness in life. Yeah. So we got to also get the word out for our older patients.
To make sure that, when you reach that age that you're supposed to be screened, that you go for those screenings every year.
Yeah, and I think the other thing is that increasingly we're making women more aware that breast cancer isn't a death sentence. Over 90% of women will live certainly 5 years, and then the vast majority of them will live well beyond that, like long, healthy lives.
That's probably one of the most important messages to get out, because I'm here to tell you that I hear from women on Twitter, on Facebook, who say, I'm so glad you're doing well. I'm not going for a mammogram, though, because I don't want to lose my hair and I don't want to lose my breasts. And I want to jump in my car and say, where do you live? I'm coming to your house. But that fear and that myth that if you get breast cancer, you die, is what I think keeps a lot of women away.
Yeah. And people are scared of the treatments, and they hear the horror stories. You know, no one who's having a good day is tweeting about it. You know, it's like the news. And so I think we're getting the word out that most women are survivors, and the earlier that we can detect it, the less treatment a woman has to go through in general, with some exceptions, and the more likely a woman will be cancer-free in the long run and live a healthy, long life.